Hello everyone. Welcome to Proactive Physio Podcast, Season 4, Episode number 2. I want to start with a question we all face daily. A patient comes with a clear localized pain, let's say a right side shoulder impingement. We assess the joint, the rotator cuff, the scapula muscles. We find weakness, we find tightness. We treat it, but then 3 months later, they are back with the same issue, or maybe a new one on the opposite side. So, why this happens? You can have the strongest, most powerful rotator cuff in the world, but if the foundation, the core, the trunk, the opposite hip is unstable and uncoordinated, the shoulder is doomed to fail. It's a movement problem disguised as a tissue problem. Today, I want to spend a 10 minutes reframing our perspective. We are going to move beyond just diagnosing painful tissue and embrace a framework where movement creates a clarity. The cornerstone of this approach is the performance pyramid. Imagine a simple 3-layer pyramid. The base, movement, competency. This is the foundation. It is not about strength or endurance. It is about the quality of the fundamental movement patterns. Can the person hinge, squat, lunge, push, pull, and carry with control, stability, and symmetry? This is the software of the body. Without this, nothing above it is sustainable. The middle layer is about movement capacity. Once the movement pattern is correct, then we layer a capacity. This is your traditional exercise as a medicine. Strength, power, endurance, and conditioning. This is the hardware. We spend most of our time here, but it is ineffective if the foundation is cracked. An apex movement skill. This is the specific skill task. The golf swing, the running gait, the overhead lift. This is a sports specific or a job specific performance. The crucial role is the critical rule is this: you cannot build a capacity on a dysfunctional movement, and you cannot expect a skill without capacity. If a patient's pyramid is upside down, all skill and capacity on a shaky base of poor movement, and we are merely managing a symptoms, not solving the problems. Our job is to identify the level of the breakdown and to build the pyramid back up from the base. So, how do we assess this? We move beyond the specific screen and think in terms of a flexible clinical framework. We are not just looking for pain, we are looking for arrested development in the movement pyramid. We ask 4 questions through movement. Can they get into the position? This is about mobility and a motor control. For a hip hinge, can they dissociate their lumbar spine from their hips? This tells us about the fundamental joint by joint mobility and stability. Second one, can they hold the position? This is about stability and the endurance. In a plank or a single leg stance, do they collapse after 10 seconds? This reveals a stability deficit that will compromise any dynamic movement. Third one, can they move in and out of the position with control? This is about the dynamic motor control. During squat, does the knee valgus? During the overhead press, do the ribs flare? This is where we see the glitch in the software under the load. And the final one, can they perform the movement under a different conditions? This is about the integrating the pattern. Can they carry a weight in one hand while maintaining a level of pelvis? It's an example of suitcase carry exercise. This challenges the entire system in a real world way. So let's apply this to our shoulder patient instead of only doing the spatial test. We watch them perform a push-up, do the scapula wing. Does the core sag? That is our question number 3. hold a plank? Do they shake and fatigue rapidly? This is our question number 2. Perform an overhead deep squat. Can they get their arm overhead without compensating? That was our question number 1. Suddenly, the shoulder problem becomes a clear picture of a global stability issue. A thoracic mobility restriction and the compromised core. Movement has created clarity. We now see the why behind the tissue failure. So about the clinical application, we need to building the foundation first. Without building the foundation, we cannot build an empire. This changes our treatment paradigm immediately. Our first goal is not to make the shoulder strong. It is to make the foundational movement patterns competent. If the overhead squat reveals a lack of thoracic extension, our first intervention isn't a rotator cuff strengthening. It is restoring that mobility and retrain the overhead pattern with a dowel. If the push-ups reveal scapular dyskinesia, we don't just strengthen the serratus anterior in isolation. We regress the push-ups to a wall or incline a version where they can demonstrate a control, and we build from there. We are teaching the nervous system a better way to operate. We use a corrective exercise, not rehab in the traditional sense, but as a way to install the fundamental software. We are literally building the better foundation so that the cannon is firing from a stable battleship, not a wobbly cannon. The beautiful part is that movement assessment system approach is not just for athlete. The elderly patient with knee pain needs a competent squat pattern to get out of a chair. The office worker with neck pain needs a stable torso and a mobile hips to sit all day. The principles are universal. Let's stop being just a finders of pain. Let's become finders of movement dysfunction. Let's use a movement as our primary diagnostic tool. Let the patient's inability to perform a fundamental pattern tells us the story that their pain cannot. Our clinical mandate is to ensure the first part, to ensure our patients move well, because when they do, the pain often resolves itself. The performance improves and the results are lasting. Movement isn't just the exercise we prescribe. It is the lens through which we can see the problem, and that lens creates a profound clarity. So in summary, we started with the powerful idea that movement creates a clarity. But now we understand that the type of clarity we seek that profoundly evolved. We have moved from seeking a single ideal movement template to uncovering a patient's unique optimal strategy. This shift is everything. We are no longer fault finders, hunting for deviation from a perfect model. We are a movement detectives. We ask why this strategy for this person and for this task. And this new clarity comes into focus through the 3 critical lenses. The first, clarify through the chain. We now see the compensation not as an error to be erased, but as brilliant, necessary adaptation. They are the clues that lead us to primary driver, the weak or stiff link in the kinetic chain that body is working around. Movement clarify the source, not just the symptoms. The second one, clarity through the context. We don't assess in a vacuum. We load the system. We move in 3 planes. We introduce gravity and ground reaction force because it's under 3 real world conditions that the true strategy and its flows are revealed. A perfect plinth exercise means little if it falls apart the moment you step, reach or lift. Movement under load clarifies a true capacity. So the third is clarity through the purpose. We rigidly connect every impairment we find to the patient's goal. Does that stiff hip matter for their ability to garden? Does the scapula winging cause pain when they lift the child? If it doesn't impact their life, it's not our primary target. Movement in the context of their life clarifies our clinical priorities. We honor that motion is lotion by getting people moving safely, but we ensure a quality enable quantity by refining their strategy to be more resilient. So when we say movement creates a clarity, we mean it reveals the individual's unique story, their constraints, their adaptations, and their potential. It clarifies the most efficient path from their pain to their performance. It's not about making every squad look the same. It is about making every person move better for their body and their life. And that is the clearest and most powerful goal we can have. Thank you so much. If you like this podcast, don't forget to share.